The mission statement of Shattuck Partners is basically to improve the quality of life of the patients as more or less a supplement to the state system, because the Shattuck Hospital is a state hospital.
For many who come to the Shattuck, it's also a place of hope, recovery, and healing. The patients are referred by other healthcare organizations around the state.
What we try to do is make sure that when they're staying at the hospital, we can supplement and offer certain programs, like art programs, that permit them to express themselves more fully. And our long-term role, and what we're trying to do now, is to facilitate their return into the communities.
One of our core missions is to partner with local community organizations that are benefiting the health of our community. Shattuck Partners really champions the cause of those patients who are seriously mentally ill. They may be schizophrenic, homeless, and very sick.
I work with the Department of Public Health, so we often work with people that have an acute illness or even a chronic illness which requires them to be in an inpatient hospital. For many people, that's very stressful.
I took care of a young woman. We ended up diagnosing her eventually with tuberculosis. We were very fortunate that we had Shattuck to be able to take a patient like her.
All of our workers are required to go to a vocational skills group. So we'll work on a resume if they'd like, we'll practice applications. So we really go from whatever their goal is and try to help them achieve it.
The job coaching here in the gift shop is teaching them how to manipulate the cash register, how to make change, how to just interact with customers. Part of the skills that I believe they learn is just being responsible.
Our mission is really to provide services to help patients transition back to the community. And so the patients coming through the vocational program are learning important life skills and job skills that they can take back and either apply in other programs or in meaningful work.
Getting up every morning and have an assignment, it just changes their whole perspective in life. They want to go out and get a job. If self-esteem improves, they just want to be contributors to the community at large.
My name's Kathy Oros. I first came here in July of 2009 for domestic violence, substance abuse, and being homeless. And I took advantage of a lot of the programs that were here. They had one that really outstood to me, and I really loved it. It was called the Art Program. It was right next to doing therapy, except the therapist wasn't in the room. The paper was your therapist. It was really good because all the different colors meant something. It made my negative, they turned it into a positive.
Our weekend art and poetry workshops or our new songwriting program really help patients look inward, outwardly communicate with others.
All of us really see this deep connection between music and health and healing. And so I think the ability to be able to do songwriting or playing instruments and doing some kind of music is such an enriching activity beyond the doldrums of being in a hospital and just trying to get better from being sick.
The recreational programs are so important because they provide a sense of community in the hospital for the patients. They also replicate activities, forms of self-expression that they will be engaging in when they're out in the community. The art programs are really beneficial for therapeutic outcomes because the patients get to explore their inner feelings.
So we give them the opportunity to express themselves. We subsidize workshops for basically songwriting, poem. We have experts come in to teach our patients or to let them express themselves.
The arts provide a vehicle that's frequently nonverbal in how somebody can express what's experiencing them through art, through drawing, through painting, through printmaking, through poetry. And that's a very different type of expression and allows people to access aspects of themselves and then share it with others within the art group in a way they find very beneficial.
It's very interesting to see someone that feels terrible and they're given the opportunity to express themselves and do something.
I only thought negative of myself. I didn't like myself. I thought I was ugly. I thought I was fat. And if there wasn't somebody there to help me, I wouldn't be here today. I probably would have been 6 feet under by now.
Unless you apply yourself, you can do it. You can do anything.
I want to thank Shattuck for giving me my life back. Without them, I don't think I'd have my life today. And that's honest to God's truth. They're good people.